Hello there. You are watching this video because you are an international medical graduate from China, Ukraine, Russia, Cuba, or from any other recognized medical college overseas and are preparing for your Ghana Medical and Dental Council licensure exam. Hello there. You are watching this video because you are an international medical graduate from China, Ukraine, Russia, Cuba, or from any other recognized medical college overseas and are preparing for your Ghana Medical and Dental Council licensure exam. Let me say a big congratulations to you for successfully completing your medical program overseas. Well done. Now, you have heard or probably have read a new document concerning the new GMDC licensure exam format, which otherwise has been dubbed the OSCEs, and are looking for a video which would help you strategize for your exam. Welcome, Doc, to the TutorMed community. Please feel at home, relax, and watch this video till the end as I comprehensively walk you through the new GMDC exam format. You've got any questions? Put them in the comment section below. I'll be willing to answer them. Great. And so a little information about myself. I am Dr. Kofi Amuako Obenfrempong, a medical practitioner with keen interest in medical education. And yes, where did I train? I trained in the University of Ghana Medical School. Fantastic. And so before we take a look at the new GMDC exam format, let's take a look at how the old exam format was like. How were international medical graduates examined by the Medical and Dental Council of Ghana until June 2023? Now, the old exam format was in 3 sessions. The first session was an MCQ paper made up of 100 MCQs, 20 each from internal medicine, surgery, obstetrics and gynecology, pediatrics, and community health. There were 4 possible answers of 4 options from which you were supposed to choose the single best answer. And yes, you were supposed to answer those questions in 2 hours. And so the second session was a short essay theory question where you had 5 major questions, each coming from internal medicine, pediatrics, surgery, obstetrics and gynecology, and health, or community health, I should have said. And you had 2.5 hours to answer them. And the last session was a viva station where each candidate had 10 minutes to be examined by 2 examiners. And here, the questions varied from being asked simple and straightforward questions to being asked to perform an examination on a mannequin. For example, perform or demonstrate how to elicit shifting dullness in a mannequin. And so the MCQ and then the theory questions were written on the same day at the Ghana WAEC Hall, while the viva station was written the next day at the Kolebu Teaching Hospital. Then, boom! The Medical and Dental Council of Ghana decides to change the exam format. And so what is the new exam format? Let's see that. Now, the new GMDC exam format has 2 steps. GMDC registration step 1 and GMDC registration step 2. This can be likened to USMLE step 1 and USMLE step 2. Now, candidates are required to pass GMDC registration exam step 1 to be eligible to write the step 2.
And so let's look at what GMDC registration step 1 is all about. The paper is a theory paper which is made up of 200 MCQs. It is subdivided into Medical 1 MCQs and Medical 2 MCQs. Medical 1 MCQs are written first in an hour, and then it is followed by Medical 2 MCQs. Now, Medical 1 is written first over an hour, then 30 minutes break is allowed, then after which we write Medical 2. And so, how different is the MCQs in Medical 1, or how different are the MCQs in Medical 1 from the MCQs in Medical 2?
Good. And so the MCQs in Medical 1 predominantly tests your ability to apply the knowledge you've acquired in basic sciences and paraclinical sciences to clinical situations. And they are the single best answer question type, where you have 4 options or 4 possible answers from which you are supposed to pick one single answer. And so here, the council exam tests your ability to apply the knowledge you've acquired in anatomy, physiology, biochemistry, immunology, pathology to clinical cases. They usually give you a clinical vignette and expect you to apply the knowledge you've acquired in basic and then paraclinical sciences. And so, for example, instead of asking you a straightforward question like, which of the following organisms is an encapsulated bacterium? A. Streptococcus pneumoniae. B. Yersinia enterocolitica. C. Campylobacter jejuni. D. Bordetella pertussis. This is a straightforward question, but in Medical 1, it is not asked in this format. The question will be put in a clinical vignette and may come in this format, like a clinical case. A 17-year-old girl known to have sickle cell disease genotype HBSS came with a history of recurrent infections, and an abdominal scan was done which showed autosplenectomy. Which of the following will be most likely cultured from her blood? A. Streptococcus pneumoniae. B. Yersinia enterocolitica. C. Campylobacter jejuni. D. Bordetella pertussis. And so here, the question is a microbiology question, which is a paraclinical science or entity testing our knowledge of encapsulated bacteria. How did we know that? Because we know basic science or paraclinical sciences teach that the spleen deals with infections caused by encapsulated bacteria. So if this patient has autosplenectomy as a result of sickle cell disease, then she will be susceptible to infections from encapsulated bacteria. Mind you, sickle cell disease patients may have autosplenectomy because of repeated splenic infarcts, and this will result in hyposplenism or dysfunctional spleen. And so what are the encapsulated bacteria in microbiology? Let me give you a list, although this list is not exhaustive. We have Streptococcus pneumoniae, then Streptococcus agalactiae, which sometimes is called Group B Streptococcus. Remember that Streptococcus pneumoniae featured in our question, option A. Then we have Haemophilus influenzae, Neisseria meningitidis, Escherichia coli or E. coli, Salmonella species, Klebsiella species, and then Pseudomonas aeruginosa. Maybe this mnemonic may help keep this list. The mnemonic is P.S. Shanks, if you will. And so, P for Pseudomonas, S for Salmonella, the next S for Streptococcus pneumoniae, H for Haemophilus influenza, E for Escherichia coli, N for Neisseria meningitidis, K for Klebsiella species, and the last S for Streptococcus agalactiae. And so based on this, the answer to our question will be option A. And so friends, please do not forget to like and share this video if you find it useful. And do not forget to subscribe to our channel. Hit the notification bell so that when new videos like these are uploaded, you may be notified. How did you find the clinical application of the basic science or the paraclinical science knowledge we just saw? Let me give you an example or another example. Now this example will be an applied question in anatomy. And so instead of asking this plain and straightforward question, where does the medial aspect of the foot drain into? A. Popliteal lymph nodes. B. Para-aortic lymph nodes. C. Vertical inguinal lymph nodes. D. Horizontal inguinal lymph nodes. This is a straightforward question, and then to put it in a clinical vignette, the question may be in this format. A 57-year-old type 1 diabetic mellitus patient develops a boil on the medial aspect of the foot. Which groups of lymph nodes are likely to be enlarged and tender? A. Popliteal group of lymph nodes. B. Para-aortic lymph nodes. C. Vertical inguinal lymph nodes. D. Horizontal inguinal lymph nodes. So yes, the answer to this question is a vertical group of inguinal lymph nodes. And so this is what we mean by application of basic sciences and paraclinical sciences. Sometimes you may meet a few public health or community health questions here in Medical 1. And so the MCQs in Medical 2 are applied clinical sciences, which test the candidate's ability to understand the evolution of disease processes, the candidate's ability to diagnose diseases, his ability to interpret investigations, and his ability to institute appropriate management steps in the areas of internal medicine and therapeutics, surgery, pediatrics, obstetrics and gynecology, and then psychiatry. Now, just like in Medical 1, this aspect of the exam would not test just clinical sciences. You may see a number of community health questions here. And so because of this, we should pay attention to the various sub-disciplines in community health, particularly in epidemiology. Pay so much attention to epidemiology, biostatistics, demography, environmental health, health and then health systems. Now, although I have mentioned it already, I should emphasize again that paraclinical sciences, I mean interpretation of lab investigations and radiological investigations, may also be tested here. And so you can be given a full blood count results in Medical 2, asking for the interpretation. You may be given a CSF analysis report to interpret. You may be given a CT scan to interpret. And so let me give you one example here of a question in Medical 2. The question will be like this. A 67-year-old man came to the OPD for his routine medical checkup and was found to have an HB or hemoglobin of 5.5 grams per DL, but was not symptomatic. What is the most appropriate next step of management? A. Prescribe oral hematinics and discharge home. B. Admit and start oral hematinics. C. Admit and transfuse with blood. D. Reassure and refer the patient to the dietitian for counseling. You get the format I'm trying to describe. This question, for example, is testing our knowledge on the management of anemia. This man has severe anemia and so has to be admitted and transfused. And so here, we need to know the indications for transfusion in a patient with anemia. And so friends, in all, we've seen that there are 200 MCQs in GMDC Step 1, 100 in Medical 1 and 100 in Medical 2. You are required to pass or have a pass mark of 50 to be able to write GMDC Step 2. And I wish you all the best. It has been a long tour, isn't it? Let's take a break and come back, discuss GMDC Exam Step 2. Great, and so congratulations for beating GMDC Exam Step 1. Now let's move to Step 2. Step 2 is also known as the Objective Structured Clinical Exam, abbreviated as OSCE. It is divided into the unmanned OSCE station and then the manned OSCE station. Now, what is the difference between the unmanned OSCE stations and then the manned OSCE stations? The unmanned OSCE stations have no examiners physically present, but the manned OSCE stations do have examiners physically present. For the GMDC Step 2 exam, the unmanned OSCE paper is written first, and the manned OSCE exam the next day. And so, let's see the unmanned OSCE station. Great. And so for the unmanned OSCE stations, candidates are put in a room, a very big room, and then PowerPoint slides are projected. Those slides are usually pictures with some attached questions, about 3 to 4 of them. Candidates are supposed to study the picture and then answer the attached questions within 3 minutes. This means that after 3 minutes, the slide will automatically change. And so you have to speed up your game, or else you may not be able to answer the questions within the 3 minutes. And so what areas, or which areas would the Unmanned OSCE usually cover? The areas that will be covered include internal medicine and therapeutics. Usually you are shown 3 pictures from this discipline, then 3 pictures from surgery, 3 pictures from pediatrics, and again 3 pictures from obstetrics and gynecology. Then you may have a varied number of pictures from community health. It may be 1, it may be 2, sometimes it may be as many as 6. And so which questions are projected for internal medicine, surgery, pediatrics, com health, and the like? What type of questions are projected? For example, in internal medicine, you may be given a lab investigation to interpret. It may be a liver function test, a thyroid function test, a hepatitis B profile. You may be given an ECG to interpret, maybe an ECG of a patient with myocardial infarction, and you'll interpret with some attached questions within which you are supposed to answer within 3 minutes. Again, in internal medicine, you may be shown a picture of an X-ray, a plain chest radiograph maybe, or you may be shown a picture of a CT scan of maybe a patient with hemorrhagic stroke. You may be asked to describe the radiological investigation and then answer some questions on them. Again, within 3 minutes. Again, in internal medicine, you may be shown a picture of a medical equipment, say a chest tube, a spinal needle, urethral catheter. You may be asked to identify the medical equipment and then state some indications for its use. In fact, state the procedure that medical equipment is used for, state the indications, contraindications. The last thing in internal medicine is that you may be shown a picture of a patient with a clinical sign, say a woman with an erythematous or a raised erythematous rash on the malar region or on the cheek region, asking you to identify or describe the picture and then give a spot diagnosis for the picture shown. And so people, spot diagnosis please. What is the spot diagnosis for the patient who has a raised erythematous plaque on the cheekbone, or on the malar region? Yes, someone is saying SLE, systemic lupus erythematosus. So after you've been able to, describe the picture and then you've stated your diagnosis, 2 other questions may ask for investigations and then maybe 2 drugs used to manage this condition. And so, hey, enough of internal medicine. Let's move to surgery. What can happen in surgery? You may be shown a picture of a patient again with a clinical sign, say jaundice. There, you know that you are going to discuss a patient with obstructive jaundice. So you may be asked to describe the picture and then give how the liver function test would look like in this patient and then give 2 maybe differential diagnosis. Again, in surgery, you may be shown a picture of a radiological investigation, say a plain lumbosacral X-ray of a patient or a man who has some urinary tract symptoms like strain or micturition, and then he came with hematuria. Straightforward, you know that you are going to discuss a prostate CA with a lumbosacral vertebral metastasis, if you will. You may also be shown an equipment, a medical equipment, maybe an NG tube, again a urethral catheter. You may be shown a chest tube. You may be shown some surgical instruments, and then you are supposed to identify and then give some uses of these instruments. And so these are the various ways the Unmanned OSCE can be presented to you on the slide in surgery. And so how about obstetrics and gynecology? How would the Unmanned OSCE station be like? Again, you may be shown a picture of maybe a pap smear test kit. You'll be asked to identify the test kit and then maybe state what it is used for, and then state maybe how the pap smear result is reported. You may be given a picture of a placenta. You are supposed to identify the type of placentation and then again answer some questions on them. You may be shown a radiological investigation, maybe an ultrasound of the uterus, showing the snowstorm appearance or the honeycomb appearance of a patient with molar pregnancy. Describe what you see. What is your likely diagnosis? How would you investigate this patient? What will you do for this patient? Again, obstetrics and gynecology may show you some contraceptive methods. You may see the IUD device, you may see the cyclical beads, identify A, identify B, what is A used for, what is B used for, in that manner. The last clinical subdiscipline we will look at is the pediatric subdiscipline. How will they present their unmanned OSCE stations to you? You may be given a patient or a picture of a baby with neonatal jaundice. Describe, diagnosis, what are the causes, investigations. You may be given a picture of a patient with hydrocephalus. Describe what you see, what is your diagnosis, how would you manage the patient. You may be shown a picture of a blood film comment showing some malaria parasites. Again, describe what you see, what is your diagnosis, and then it follows like that. As for community health may show you pictures or may not show you pictures. Community health may show you a picture of, say, the Anopheles mosquito. You are going to discuss malaria. Community health may show you a picture of a sanitary well. You are going to discuss the features of sanitary well. Or may not show you pictures at all. They may ask plain questions like, for example, let me give an example. List the various levels of disease prevention: primordial, primary, secondary, tertiary. They may give you the pyramid of the Ghana health system. You know that you have level C, level B, and then level A. Level A is a primary care system, right? Or primary health care level. So they may show the pyramid and then put some, label it and ask you to give the levels of primary or levels of healthcare based on the pyramid, and then the questions will follow. And so there are a variety of them. I hope this presentation has given you an idea of how your unmanned OSCE stations may be. And so what are the common mistakes that are made during this aspect of the exam? We fail as candidates to realize that this is a speed race. Knowing the answer is not the only important thing. Another important thing is your ability to write fast. And so we fail to realize that being fast is also imperative in passing the unmanned OSCE, because remember, people, that it is just 3 minutes. And so you may know the answer, but if you do not write fast, it is akin or similar to someone who did not write the answer because he didn't know. And so please ensure that your speed and accuracy are worked on when it comes to your unmanned OSCE station. Good. And so the unmanned OSCE stations back. And so we move to the manned OSCE station. And so friends, thank you for staying tuned till this time. Watch this space for the part 2 of how to ace the new GMDC exam format easily.